Thank you. Next we have Linda Hinton.
I'm the Government Relations Manager for the Iowa State Association of Counties, and I'm here representing ISAC. ISAC is a private nonprofit corporation whose members are county officials from the 99 counties in Iowa. One of the building blocks of the redesign process that we're currently going through in regard to Iowa's mental health and disability services system managed by Iowa's counties is Medicaid expansion. When we first heard about Medicaid expansion 3 or 4 years ago, it was part of what spurred the discussions about making changes in the way that we manage services in Iowa. Medicaid expansion is expected to save up to $60 million annually in mental health care costs for persons with incomes at or below 138% of the federal poverty level. I said, and I reiterate up to, I think the estimates are for $27 million to $60 million, depending on the benefit package. And it would be an estimate of 110,000 to 180,000 Iowans. The county property taxes currently used to fund these services would be freed up to meet the requirements of the MHDS redesign. Work groups have outlined new mental health services that must be provided statewide, and services for persons with developmental disabilities and brain injury are to be added to the system when funding is available. The governor's plan will only cover an estimated 89,000 Iowans with fewer services, thus leaving the counties to provide for both the individuals and the services that are not provided under his plan. While ISAC would be opposed to the governor's plan solely based on the comparisons of coverage, the financing of Healthy Iowa with $85 million worth of county property taxes is unacceptable. The $43 million in mental health levies from each county in Iowa are already budgeted to fund the county-managed mental health system in the coming fiscal year and beyond. By adding $42 million from the Broadlawns Hospital property tax levy, the property taxpayers in Polk County bear an inordinate percentage of the governor's proposal. Beginning in 1996, the state and the counties have worked together to move the cost of mental health and disability services off of property taxes. There was an agreement at that time that property tax was not the appropriate funding mechanism for these services. By the same token, they are not an appropriate funding source for statewide health insurance program. Iowa counties are willing to work with both sides in coming to a proposal that best meets the health care needs of Iowans in poverty, but we cannot jeopardize the success of the redesigned regional MHDS system by allowing the scooping of local property taxes to fund Healthy Iowa.
Ms. Hinton, your time is up. Thank you. Next we have on the list, Deb